I'd like to welcome everyone to today's presentation. And for our first presentation of the UAGC Research Symposium for 2022. My name is Dr. Tim Rice, and I am the lead faculty member for the Doctor of Psychology program here at UAGC. And it's with great pleasure that I get a chance to introduce you to our first presenter today. This is Dr. Rachel Hoeft, and I was fortunate to chair her applied doctoral project that she'll be speaking about today, confidence issues during athletic injury recovery. I wanted to just communicate this to everyone as well, that if you have questions, please feel free to use the chat function here in Zoom, and I will be the moderator, and we will ask those questions in the last 5 minutes of the question and answer session. So without any further ado, Dr. Rachel Hoeft.
Thank you, Dr. Rice, and good morning, everybody. I am very excited to be here, so thank you so much for joining me. And with that, we'll get started. So again, the title of my applied doctoral project, or ADP, is Confidence Issues During Athletic Injury Recovery. To give you just a little bit of background on myself, I graduated from the UAGC PsyD program last September in 2021, and my specialty was sport and performance psychology. And now I'm lucky enough to be able to use that degree as a mindset coach at IMG Academy. And my job there is to work with athletes and coaches and parents so that athletes can improve the mental side of their game and their competition. And quick fun fact about me: in my time playing competitive sports, I tore my ACL 3 times and I had 1 meniscus tear. And collectively, that was the inspiration for this applied doctoral project. So quick overview here. I will just take you through the background and the a setup for my ADP, the findings that came from the research project, and the recommendations I have for future research, and then the confidence boosting guide that I created for injured athletes and their support system using all of that information. To provide you a little bit of background on this topic, athletic injury is very common in competitive sports. And although this is common, many players are not psychologically prepared to return to their competition after they have been fully cleared to do so. And this is often from a realization that they are vulnerable and lacking confidence in their abilities. Confidence has been identified as a very key component in an athlete's mental preparedness to return to their sport. And if an athlete is lacking confidence, this actually increases their likelihood of re-injuring themselves and can contribute to their overall decision to retire from the sport. So proactively targeting confidence and building that up may be a way to improve the injury rehabilitation process and keep more athletes in their sport. Previous research has identified that a combination of low confidence and high fear prevents athletes from returning to sport, but there is a lack of understanding as to what particular situations impact confidence directly. So the purpose of my ADP was to identify those common themes and issues that relate to confidence during injury recovery, and then use that information to create a confidence boosting guide for injured athletes and their support network. So why is this important? As I've mentioned, previously injured athletes were not always returning to their sport, and that is because a lack of confidence prevents them from feeling comfortable and ready to do so. Now, previous research has identified that certain milestones, interactions, and events can contribute to an athlete's change in confidence levels, whether positively or negatively. And previous research has also identified and applied various mental skills that target boosting confidence. Additionally, there is still a lot of information to be uncovered relating to this topic. The theoretical framework for my ADP was based around self-efficacy theory. Now, Bandera states that there are 4 main elements that contributes to a person's self-efficacy or belief in their ability to execute a task. And you'll see here those 4 elements are verbal persuasion, physiological feedback, vicarious experience, and previous achievements. Now, it's important to differentiate between confidence and self-efficacy. Confidence is a person's relational emotion and their belief in their abilities depending on the situation. So it changes based on how they evaluate their ability to succeed in that moment. So in comparison, self-efficacy is a long-term belief that they are capable of doing something, but confidence changes from moment to moment based on the person's assessment. The approach that I took for my ADP was a thematic synthesis systematic literature review, or SLR. Now, data is collected by starting very broad with common themes, and then as more data is uncovered, the groups get a little bit more specific. The categories that I started with were mental skills and then generic positive and negative experiences. And as more data was uncovered, I expanded that to positive and negative milestones, interactions, and events, and additional information for the confidence boosting guide. The overarching research question that led my ADP was identifying the events, interactions, and milestones that commonly influence an athlete's level of confidence during their injury recovery. And the sub-questions targeted the coping mechanisms and mental skills that athletes use to boost confidence, and then what other areas of this topic still need additional research and exploration. Now, in a systematic literature review, this is a target for, you're using previously completed research studies. And so qualified studies for this ADP required that participants were elite athletes, so NCAA or NAIA D1 or D2 athletes, semi-professional or professional athletes who sustained an athletic-related injury that was severe enough to require surgery and physical therapy as part of the rehabilitation process. Now you'll see in this graphic here, I used 3 databases to collect my information: EBSCO, Google Scholar, and ProQuest. And I used key phrases like return to sport or lack of confidence as a starting place to identify those studies. Now, I was able to identify 110 articles initially. And then as you'll see throughout the graphic, as I started to whittle away by using the qualifications you saw on the previous slide, that got me all the way down to a whopping 5 articles that met all of the qualifications for this thematic synthesis SLR. Now, before I get into the findings, it's important to address the ethics and trustworthiness of the study. So because I was using previously completed studies, there were very minimal ethical concerns here because there were no participants involved. And there are 4 elements of trustworthiness for a qualitative research project. Credibility was ensured by making sure all of the usable information met all of the qualifications. Many studies met one or some of the qualifications, but because they didn't meet all of them, it could not be used. Confirmability was ensured by addressing my own potential bias as a previously injured athlete and making sure my analysis was objective at all times. Dependability is addressed by being very explicit about the details of the procedures and the inclusion criteria. And transferability was addressed by having very wide parameters. So I used all types of injuries and all sports to make sure that this information was transferable to any person who sustains an athletic-related injury. Now, the assumptions for this ADP were that all of the information that I got from those previous studies, the data was truthful and accurate. And because of that, I was expecting common themes to emerge. I also used elite athletes as the requirement because essentially they've got more skin in the game. So their reactions are something that many injured athletes would be able to relate to. And there's always limitations and delimitations. Again, I had to address my own researcher bias. And one concern was that because every athlete's experience is unique, there's potentially no overlap. So that was the importance of starting with a very broad target and then creating more specific groups as I uncovered additional data. And again, we needed noticeable responses to rehabilitation challenges, which is why elite athletes were chosen as the main participants. All right. So in this graphic here, you will see the 5 articles that I found that met all of the criteria on the left-hand side. And across the top, you will see the themes and the groupings that emerged from the data. And that includes events, milestones, and interactions, mental skills used, and then unexpected themes. And the X's represent what type of information was taken from each of these articles. So on to the findings. First, we have interactions. And the 3 main populations that arose throughout this information and data collection was coaches, teammates, and then physical therapists and medical staff. And there were positive and negative interactions for all of those. And you'll see some of those in these blue boxes here. Now, what's interesting to note is that a lot of the interactions between coaches and teammates had a lot of overlap. Essentially, when somebody was checking in on the athlete and making sure that they were progressing and doing okay, athletes felt more positive about the interactions and had greater confidence levels because they still believed that they were part of the team and that their spot was waiting for them. On the other hand, if the coach or the teammates were not showing any interest, the athlete noted that they often felt left behind and that they were just watching from the sideline and were not part of the team anymore. With the physical therapist and medical staff, these concerns were a little bit different. Mainly, athletes wanted to have some sort of autonomy over the injury, and that essentially included them feeling like they were in charge of their goals and that they were able to move throughout their exercises feeling in control. On the negative side here, if an athlete felt that their medical professionals had conflicting opinions, this decreased their confidence levels because they were not sure who to trust and they weren't sure what their actual rehabilitation timeline would look like and whether they'd be able to make it back to their team in time. Again, there was the sense of autonomy here. So if athletes had very rigid or boring regimens, their confidence decreased because they did not feel like they were in charge of their rehabilitation. Relating to the theme of milestones here. So overall, athletes felt that their confidence increased when they were able to track and see the progress that they were making. So if they were able to look back and see that they've been improving more quickly than they expected, confidence shot up. But if they had a lack of progress or they weren't meeting the expected milestones in time, they got really frustrated and angry. One athlete noted that he started to feel very hopeless, that he would never return to his sport again. When an athlete and their physical therapist disagreed on exercises or intensity, this led to a significant lack of adherence. Multiple athletes noted that when they started bumping heads with their physical therapist, they actually tested their boundaries outside of the physical therapy environment. Now, what's interesting to note is that all of the athletes who did that actually had increases in confidence because they knew that they were capable of increasing the intensity or the weight load. And so testing these boundaries proved that they were more capable and that they could push harder. So it made them feel like they were making progress. Lastly, they needed to have achievable deadlines because if they were not meeting these milestones in time, their confidence decreased. So relating to the theme of mental skills here, the number one confidence boosting skill was goal setting. So when athletes were able to collaborate with their physical therapist, this increased their motivation and adherence to the physical therapy regimen because it brought in that sense of autonomy. They knew exactly what it was that they were trying to achieve, and it addressed what the athlete was overall desiring. Other mental skills that were noted include positive self-talk and healing imagery. One athlete noted the importance of being organized and creating a schedule that was pretty strict and solid in comparison to when they were playing their sports because they have very busy schedules. So if they didn't have anything to do during the rehabilitation, that prevented them from feeling like they were an athlete still. Lastly, mindset shifts were a big part of feeling more confident. Athletes needed to accept that injury was just part of sport, and this was another more difficult obstacle that they just needed to overcome. All right, so here we've got recommendations for future research. So some of the limitations for my ADP had included that there were only 5 articles that met all of the qualifications. So it might be helpful to widen the parameters and include different levels of athletes. So including NCAA or NAIA D3 athletes, junior college or club and travel athletes, and then increasing parameters to include any injury that results in time away from the sport. Now, there's still a need for additional research relating to interactions specifically with family or friends. There's very little information about how these populations can help impact an athlete's confidence. And many research studies right now acknowledge that confidence is important, but they don't target confidence specifically because it is just a component for psychological preparedness. There are many other things that contribute to that, but there's very little information that focuses directly on confidence. And because athletes have very unique experiences, there still needs to be a little bit more understanding relating to the unexpected events that happen and how that impacts athletes' belief in their abilities. So here you will see my confidence boosting guide. The first page here, I divided that up into a few different categories. So understanding why confidence is necessary during recovery, how people can support an injured athletes, and the various personal characteristics that are necessary for an athlete to boost their confidence. And the backside here, different confidence boosting strategies, as well as the mindset shifts that contribute to increased confidence, and the mental skills that people can learn and apply so that they feel more confident in their abilities. Oh, it's skipping some slides here. There we go. All right. So in summary, athletes are getting injured, but they're not always prepared to handle the psychological recovery. And confidence is a factor that significantly influences whether an athlete returns to their sport. Now, fluctuations in confidence can be attributed to the various interactions, milestones, and events that athletes experience during rehabilitation. And athletes can boost their confidence by using various mental skills like goal setting to help feel more confident in their progress. And as they increase levels of resilience and self-motivation, this helps them to overcome those challenges more easily. And lastly, more research is still necessary to understand how various interactions and events can impact confidence during the rehabilitation process. All right, that is all from me. So Dr. Rice, if you can help me out with any questions here.
Yes, thank you very much. One person, Lauren Martin, actually commented, interesting presentation, Rachel. I enjoyed learning about the differences between short-term confidence and long-term self-efficacy. And I want to kind of jump on that real fast and pose a question to you. And it's regarding, how important is self-efficacy when someone gets injured?
So it's a really good question. And I think the most difficult part with a severe injury the first time around is that they haven't had any sort of previous experience to show them that they are capable of returning. So one of the elements that contribute to a person's self-efficacy is their previous experiences. And aside from that, it is vicarious experience. So understanding and seeing other people have returned from this and they've been able to come back to the sport. And so having a really significant support network that can help athletes feel like they are capable and that they can train together can be a really big impact on an athlete's ability to return to their sport.
Okay. I have a question from Dr. Peggy Sundstrom. What were you most surprised to learn, Rachel?
That's a good question. I would think maybe the overlap between interactions between coaches and teammates. I feel, at least in my own personal experience, that I just had so many individual interactions with each person that I was talking to. And I don't think I really realized that I was searching for the same thing from all of them. So, wanting people to show interest in my progress and them being concerned about my return to the sport. And what I needed was support and interest and confidence from them that I was going to come back. And so, I would think, being able to teach a coach how to interact with their injured athletes is very important, but also the acknowledgement for teammates and how they can impact their friends and their belief in their abilities to return. And so I think that is something that can be very useful for application in this field is how can we teach teammates to contribute to their friends and their teammates rehabilitation.
Okay. One other question, there are a couple more questions here, but one I'll just add on from Dr. Sundstrom. She asked, how did your own recovery change once you did this study or project?
So it's a really good question. At this point, I wish that I had access to this information when I was going through my recovery process, because there's just so much that I didn't realize I was going through and how I could have addressed that. And so it's been 11 years since my very first ACL tear. And every day I still have, some concerns when I'm running down a hill or when I'm jumping at the gym. And so I have to remind myself of the characteristics that can help build confidence. And so reminding myself of the times that I've completed exercises correctly and successfully, and knowing that my body is strong enough to handle these exercises. And it's just my own fear that's preventing me from exercising and executing the actions correctly. And so when I can take this information and essentially, take some of my own medicine from my confidence boosting guide, that helps me to exercise and to use my body the way that it has healed and feel confident doing it.
Great. One other question comes from Paul Schultz. As a D1 track athlete, this presentation is so true and so important to understanding. Even minor injuries had an effect on confidence. Question: who has the most influence on athletes in boosting their confidence? Coaches or caregivers?
That is a very good question. And I feel like the main answer here is really it's going to depend on the athlete and who they trust the most. So if they have a coach that has been supportive for them for a very long period of time and they've seen improvement by listening to that coach, I think that person is going to have a greater influence over their friends and family, especially if they don't understand the sport that the person is in. I will say from my own experience, I had somebody who has never played soccer tell me after I tore my ACL that I actually didn't need to have surgery and it's going to heal on its own and I can actually just get back into playing soccer. And I will tell you right now, I knew that was not the case. So I think it's going to come down to ultimately which person has the greatest influence over the athlete and how they have helped them most consistently. If I have to give you a direct answer, I would think that probably the coach.
Okay. One other statement, basically, one just popped up here. Actually, Paul stated, "Thank you. I agree so much. Trust is so important." Couple of comments. Dr. Rosser, Michelle Rosser Majors stated, "Nice job sharing this information, Rachel." And then Dr. Ted Ellis said, "Thank you for this excellent presentation." As we finish up here for your presentation, because we have about a little bit, right around 5 minutes or so. I wanted to ask you, there are people probably going to be watching this presentation that are going through the process of completing a doctoral project. Can you give just a couple of tips to those people that have never done research before and what's some things that you would give them? Two bits of advice.
Yeah, so I would say the number one thing, the number one tip that got me through this project, I actually received this at one of the UAGC in residence weekends, was to write a little bit every single day. So I made it a goal to write at least one paragraph every day from the day that I started until I was completed. And by the time you write one paragraph, you're in the zone and you probably get through at least 4 or 5. And so you've got, roughly another page down. And so that is very helpful in terms of keeping the progress going and then not feeling like you're getting caught behind. And the other one for me, as I mentioned at the beginning of this presentation, it's a very important topic to me because I have gone through injury rehabilitation so many times. And so it's information that I knew was necessary for other people like me. And so I was able to latch on to that importance, and it really motivated me to keep going. So I would say, whatever your topic is, find something in it that you really connect with and use that as your motivation to keep going. Because if this is something that's interesting and valuable to you, somebody else is going to find value in it. And so really holding on to that is going to keep that motivation going.
Excellent advice. Does anyone else have any questions for Dr. Hoeft? All right. Well, I do appreciate the good questions from everyone. And Dr. Hoeft, do you have anything you'd like to close with?
I mean, not too much here. Thank you, everyone, so much for being here and for your questions. I really appreciate that. And thank you for this opportunity to present my research. I love it.
Awesome. Dr. Sundstrom commented in her chat just now, congratulations on your newly earned degree. And thank you.
Thank you.
All righty. Okay, thanks everybody for being on this presentation today with Dr. Rachel Hoeft. We do have Dr. Jacinda Conrad coming up here in about 8 minutes. So you want to stick around. It's another sport and performance psychology presentation. Some of my favorite ones. So thank you so very much.